So, a topic I've been avoiding for a while now is kind of the geriatric care of pets and the decision that we sometimes have to make. In veterinary medicine, it is a privilege um, to be able to put an animal out of their suffering. But it's hard nonetheless. It's hard as a vet. When it's your client, it's even harder as an owner. And so Belly here, short for Bellissima Muñeca, she has been with me for 16 and a half years. And she was like a puppy until maybe a year ago. She was happy and healthy. I had another dog. I had a Yorkie, and the Yorkie ran away. She was very old. She was senile. She had urinary incontinence. There were a lot of things going on with my little Yorkie, Bossy. But Belly was the healthy one throughout her life. And I blamed both of them for the bad things that I thought they were doing, like peeing on things or getting into the garbage or whatever. But when Bossy died, Belly turned out to be an angel, and I had to apologize for all the things that she got scolded for. Because turns out Bossy was the bad one, and Belly is an angel. So, Bossy's been gone about 2 years now. She was 15 when she ran off into coyote country at the farm. Belly has been wonderful, and she has some eye issues. We've got this mild brachycephalic syndrome here. She doesn't have the flattest face, which is good, but a lot of the brachycephalic breeds have issues with their eyes. It's not just their airways. So with Shih Tzus in particular, we've got usually a lot of eye issues. She hasn't had a lot, to be honest. It was toward the end. It's been like a year or two that I've been dealing with some eye issues on her. She has dry eye, so it's lack of tear production. So that, in addition to the hair that grows there, some of the eyelid is kind of inward a little bit. It's called entropion. I've had to do a lot of drops and ointments to care for that, but just the irritation is what causes some of like the ocular discharge that you see, and it's kind of hard to maintain. The other thing that makes it hard with the just maintenance of cleaning her is that now, at 16 and a half years, Belly has epilepsy. Her blood work came back normal, so we can kind of deduce that she has a brain tumor, because the other tests, I won't get into the neurology, but we're suspecting brain tumor, and I've decided not to make her go through all of the things that it would take to diagnose and treat that. At this age, I'm more concerned with her quality of life and her comfort. So part of that is mental health, right? So I think that getting in the right space ourselves as owners is a huge part of it. So I'm here at the beach. Belly isn't really into the dog beach, so I have to confess, I am not at the dog beach. We go to the dog beach sometimes, and it's more so just to like get her some enrichment and interaction with other creatures. But she'd much rather just be here, the two of us. But She's in that little cart that I carry. We don't call it a stroller because I swore to never be that guy. So it's a little like carry-on case that I wheel her around in. So even before she started having seizures, her back legs would kind of split. And as Shih Tzus, they tend to not have the strongest joints. She was already bow-legged. She already had patella luxation. So already not the greatest conformation, even though she's AKC registered. But the hind limbs started swaying back and forth as she's walking. So the front limbs going forward and the hind limbs kind of going back and forth. And we call that hind limb ataxia. It's kind of a drunken walk that can occur on the front legs also. And sometimes it's all four, but in her case, it's the back legs. So now dealing with that progression, she has some atrophy in her back legs, so the muscles are not being used as much because she can't get around as well. I have seriously considered doing a wheelchair for her, which I might still do, but the problem that I'm having, the decision that I'm having to make is that when I travel, a lot of places won't keep her. She gets incredibly stressed out when she's at the medical boarding facilities. So it's hard to take her with me a lot of times too. She's not a huge fan of the farm. She loves being in the Jeep, so I take her with me as long as it's cool enough. But traveling becomes really difficult because I don't want my awesome neighbor who graciously takes care of her and does an excellent job. I don't want her to be as burdened as she has been with Belly here. So it does become a burden, but it's responsibility that I've enjoyed, and caring for her has been, I think, great for my mental health. And I think that this past year and a half that we've had without Bossy has been great for her as well. So as far as making a decision when to euthanize your pet, it's so hard. It's something that a lot of people would say I should have done already. There are days where I feel like that might be the case, but how can you tell, right? So, as difficult as it is, I wanted to kind of talk about that to maybe hopefully alleviate some of the guilt that some of you may be having or may have had in the past, as far as if you should euthanize, when you should euthanize your pet. So, Belly is still genuinely stable and happy, right? There are moments where she can't get around, and so that makes it a lot more difficult. One of the things I've done, just as far as her geriatric care, was to get rugs in my apartment. I have an old place that's hardwood floors, and it's beautiful, but it's very slippery for little furry paws. So I've gotten rugs that run throughout, so it's kind of created a trail for her from her food to her multiple beds and wee pads for when I'm gone. And so that has helped tremendously. I think without that, I may have already had to have made a decision to put her down, just because I work long hours. And so when I'm not available, she has to be able to get around the house, right? So the other thought with that is wheelchair, okay? Great idea. I love when owners, when pet parents can make that commitment and can, spend that time with their creatures to go and use a wheelchair. And I think that Belly would be able to get accustomed to it. She's not a fan of clothing. She'll kind of sit there and look stuck with clothing. So that was one of the deciding factors in not getting a wheelchair yet, even though I still might. She can walk when I kind of prop up her back legs, and sometimes she just needs that to get going, and then she's fine. But she definitely does a full-on middle split when she pees, so that makes it difficult. In addition to that, because she's doing a split when she pees, we come into the problem of her sitting while she pees. And then, of course, her bum is wet. Nobody likes a wet bum. So, having to clean her more regularly. But then going back to the seizures, the bath is the worst possible thing for her. It is like cruel and unusual punishment. She is not a fan, and that often triggers the seizures. Here's a clip of a seizure that she's had. So if you're kind of wary or uncomfortable with things like that, then you might want to skip ahead or, just kind of be warned. It's a little bit graphic, but it is really short. I wanted to add this just to throw in this is the reality of the matter. These are the things that have gotten me to come to this whole conversation and even thought process, is the fact that she's having seizures, but then also a part of why I haven't put her to sleep yet is because of how short they are, how infrequent they are, and how well she bounces back out of them just incredibly quickly. So it's about like 30 seconds of actual convulsion where she has kind of, it's a tonic-clonic seizure where her body gets really tense and her head back, so it kind of looks like what you would expect with tetanus. And that's that rigidity. And so after the convulsion, she is usually weak for another 30 seconds or so. And then she's up looking around, looking for food and kind of, just cool. And I know that takes a toll on her body. So I put her on medication for that. She's on an anticonvulsant. The problem with the medication, it weakens her. So it kind of depresses the neurotransmitters that cause the seizures, but it also affects the fact that she has trouble getting around, and then she kind of whines more also. And usually she's not a crier. She cries if she has to go outside and if she's hungry. But I find that with the medication, she cries a lot more, and it makes it difficult to kind of figure out what she needs at those times. But what's even worse is the fact that she has even more trouble getting around. So here's where we have our dilemma. Do I continue the medication and perpetuate the weakness? Do I discontinue it? I decided that there has to be a balance, right? So I reduced the dose of medication that she's on for her seizures, and that helped a little bit, but it's still really hard for her to get around. I can't do a wheelchair in the house. I'll post a video of my house. It's like boho kind of vibes. It's small and it's cluttered. So without her being able to lay down, of course, then that becomes problematic. If she gets caught on corners of furniture, that becomes problematic. I've closed off part of the apartment to her and moved some furniture so she has more space, with it also being a confined area that she doesn't have to worry as much about like getting to what she needs to get to. So I'm adjusting my life to fit her life, but also, I mean, when is enough enough, right? How can I decide when she seems cool and we're hanging out at the beach, we're living our best lives, but a lot of her life is a struggle. So at what point is it no longer fair for her? And that's what I have to think of. I spoke with another vet, my dear friend, Dr. Dominique Carter, who has helped me with her tremendously, who has known her entire life and has kept her before. She had to kind of remind me of my part here, you know. I can think medically all I want, and I can think like an owner because I've been one for a lifetime. But I think that having that unique combination can sometimes make it harder, but I think it gives me a good round view of what my options are and like when and where. So I wanted to kind of share that with you. So, on one hand, she seems cool. We are enjoying each other. She's not in pain. Her hind limb deficits haven't revealed any pain. The ataxia is tolerable. She can walk on concrete and she can walk on rugs. And she seems good most of the time. But it's becoming harder and harder. Harder and harder for her to get around. It's becoming more difficult for me to be at work and not worry about her, for me to go to the farm and feel like she can hang out with the big dogs, you know? And so she gets knocked down, she gets back up again. Any small incline, and she kind of struggles to stay afoot. So I think I'm at the point where it is time to make that decision about Belly. Sometimes you have to, it's okay. I want to remind you, or just let you know, it's okay to feel burdened sometimes. And I haven't felt burdened until now, because I feel like I can't leave her. There are a lot of places I can't take her. It's way too hot during the day here in Southern California for her to be in a car. Even though the Jeep has great circulation, it's really just too hot. So having to pick her up in the house is different than like just her needing me when it's time to go out. With the stairs in front of my house, there's 3 steps, and that used to be, you know, easy peasy. And she can't do that anymore. So how is she when I'm gone? I have to go to work. I can't bring her with me. I can't expect my neighbors to watch her and carry her around all day either. So I think it's time. I feel like a part of me just like I could do more and like I should do more. But another part of me is just like, is she okay? Is she really happy? What is her quality of life? Today it's good. Some days aren't. So now we're getting closer and closer to that time. Let me know what you think. Everybody has an opinion. I may or may not take your opinion. But let me know, like, what you've done. How have you made that decision yourself? If you're a vet, what do you tell your clients? You know, like when is that time? It's different when you have a sick pet that just can't go on, or you know, medication isn't working, or whatever the case may be. I wouldn't consider this really sick. You know, her seizures are controlled to the point where it's, you know, they're few and far between, they're really short. She hasn't had a big one, but we know that it will come because this is what we're dealing with now. So we know that the seizures aren't going to go away without brain surgery. That's not an option for her. She is a high anesthetic risk. Just being geriatric, we have to be concerned with her heart, her kidneys, her liver, all of those things. And even though she's got really good blood work, it would be really risky. And I don't think it would be worth the recovery time. Not necessarily that it wouldn't be worth it, but it wouldn't necessarily be fair for her. The other thing that we don't always think of, as patients versus clients versus veterinarians, and by client I mean owner. So as an owner, finances are a huge factor also. It is a sad fact that veterinary medicine is expensive. You're paying for the education, you're paying for the facilities, you're paying for the equipment, you're paying for the time, you're paying for all of these things, and it is worth it when there's a chance. And there usually is a chance. But at what point do your pockets outweigh the value of the dog's life, right? How do you quantify this animal's life? So, quantifying an animal's life, are we talking about for them? Are we talking about for us? If I can't afford to keep my pet and to maintain medications and to maintain the standard of care that she needs, then do I give her to another owner? Would she be okay with that? This is not a puppy. If I'm not with her, she's not happy. And so she's happier at home by herself than she is with somebody else. And she loves people, but it's temporary, you know? And if I'm gone and I come back, she still wants to like wiggle and play like a puppy, and she's like rolling on the floor and she's super excited. Even though she's stumbling, it's like, it's adorable, but it's also like a factor, like she wouldn't be happy with anybody else, right? And that's my dog. And these are my finances. But at what point do you consider with your finances when euthanasia is the best bet? I'm an advocate for adoption. If you have a healthy creature, please adopt them. If it is an elderly creature that is going to be more stressed out and more prone to seizures or more prone to whatever the condition that they have is, or not getting the care, not getting the medications that they need, then maybe it's time to make that decision to euthanize your pet. It's so hard. It's so hard. I've been putting this off for a while. It's really hard. It's like she's my baby. She's been my baby for quite some time now. So when do I let go of my baby? I'm making this video because the time is now, but not today. I can't today. I'm not ready today. But I have to think of her more than I think of my own emotions and my own needs. But today I am enjoying her. She seems to be enjoying me and the beach. This is a mental health moment for us. It's just to talk about it out loud, have the conversation, allow myself not to feel guilty, and talk to others. Just a guilt-free end-of-life plan for our babies, our little furry creatures here. So I hope that helps. Let me know what you think. Let me know if you think I'm crazy. I'll take it. I've got tough skin. Other than this decision that I have to make, I'm pretty logical, cut and dry, and this is not a cut and dry situation. So there's a lot of variables, and I feel for you. You are not alone. I pray that you're comforted in these times, because not always geriatric care. Sometimes it's just a sick pet, right? So I hope that you're comforted and that you can make sound decisions that are the best for you and your creature. So enjoy them, cherish them, and take lots of pictures to remember them. Bye. Belly has been crying all day. She did great this weekend. She stayed with my neighbor. Well, my neighbor came in, watched her, because she's wonderful in every way. The neighbor said it was easy this weekend. I don't know if that's because she's not seeing her or if Belly's actually doing better without me there. It's hard to tell. But she's been crying all day. I have fed her multiple times. I gave her some chicken, like barbecue chicken, which I don't do. I made her a burger, which I also don't do. I'm 1000% anti-human food for pets. But after 16 years, I feel like there isn't very much to make her happy. She's not super food motivated, so I don't know. I started giving her like extra treats, and I still don't give her very much table food, but I don't worry about like pancreatitis and whatever else. I'm not giving her anything crazy, just meat. But normally I would do that. I don't know what else to do to make her comfortable. I don't know if she's crying just for attention or if something's actually wrong. She hasn't had a seizure today. The last one I saw her have was last week, which was the first one I'd seen in a long time. Relatively, like, I guess like a month or so. They were back to back. There were two last week. And they were fairly close. So one was evening, one the next morning. It was a rough day. I thought about taking her in. So it's 11 o'clock at night, and where I need to take her is an hour away, but I'm actually going the opposite direction because I feel like I need Cold Stone. I know, it's crazy, but she hasn't been comfortable, and so getting out the house was the only thing I could think of, and I didn't just want to say, oh, well, you're not comfortable, let me take you to get euthanized. Even though that might be what I should do, I think I'm going to go after, but at least the Cold Stone will hopefully ease the pain for me. But I've been wanting it for a while, and the one that's near me is closed. So I'm going further the opposite direction to Cold Stone to make me feel better about euthanizing my dog, which is all kinds of crazy. I just don't know what else to do to make her comfortable. I don't want to sedate her, because then that defeats the purpose of living if you're sedated. If it were temporary, then yeah, sedative, wonderful. But I don't know if this will get better. It's not gonna get better, which I have come to terms with. I was incredibly distraught about it when I initially made the decision, but that was a few weeks ago now already. I've kind of just been procrastinating. There's never a good time to put your dog down. But I don't want to ignore the fact that she's crying today. I don't want to wig out about the fact that she's crying today, but I do know that it's time now. So I am going to take her in. Little girl. Sucks. But it's not fair for her to be uncomfortable. And if burgers and frequent walks and the love isn't going to do it, then it's time. Cold Stone is my coping mechanism. So we're in the grieving room. She's hot, but she's fine. She's been calm. They put a catheter in her.